Mr. Brown. I'm Tori, and I'm here with the respiratory department, and I am here today. I'm going to insert a nasal airway for you, and then I'm also going to perform some nasotracheal suction to help you get those secretions that you're having trouble getting out, expelled, or sucked out, actually, as the case may be. So the first thing I need to do is just quickly assess you. I want to check your SpO2. I want to check your pattern of breathing, your rate of breathing, your vital signs, etc. The next thing that I need to do is find the correct size of nasal airway for you. So to measure, you measure from the nose, the corner of the nose to the ear, to find the appropriate size of nasal airway. And then what we need to do is we're going to hyperoxygenate you so that you can more easily withstand this procedure. And so we're going to go ahead and do that. We're going to put you on a non-rebreather mask at 15 liters per minute for about 30 seconds. And I want you to just take some nice deep breaths for me. Okay? Alright. And then what I'm going to do here, Mr. Brown, is I'm going to go ahead and insert that nasal airway for you. And so to do that, I wash my hands. I'm going to go ahead and get some gloves on here. And then I'm going to put a little bit of the Surgilube in just the palm of my hand. And I'm just going to run that nasal airway through there so it glides more easily. Now to insert that, the beveled side is going to go toward the septum. So I'm going to go ahead and insert the nasal airway. And you don't ever want to force the airway in, so if you meet resistance and you can't get through, you just need to move to the other ear. So now that I've got the nasal airway placed, what I need to do is remove these gloves, and then I'm going to wash my hands. I'm going to open my sterile catheter suction kit, and I'm going to apply my sterile gloves. Okay, and then I'm going to go ahead and fill that tray from the kit. This tray is going to get filled with sterile saline. I'm going to go ahead and hook up my catheter to the suction on this end right here, and this is going to be my not sterile hand, and this will be my sterile hand. So I'm going to go ahead and hook that up to suction, and I'm going to put the end down into my sterile water. I'm going to occlude the thumb port because I want to make sure that that my suction's working. So for an adult, it should be -120 to -150. Okay, so then once we made sure that our suction works properly, we're going to also lubricate the catheter by just putting that Solugel into the hand and running through. And then I'm just going to wrap this around here like so. Alright, I'm going to go ahead and insert the catheter into the nasal airway until I can start seeing condensation, which is telling me that my patient is breathing, or that we've entered the trachea, or my patient might cough. Okay, and then we're going to go ahead and retract, occlude the thumb port, and we're going to suction all the way out. Should take less than 15 seconds. You can go ahead and run that through the sterile saline again if you need to, or you can just dispose of the catheter. And using my non-sterile hand, I'm going to quickly re-oxygenate my patient for about 1 minute, and that's necessary after the process of suctioning. So I'm going to go ahead and re-oxygenate my patient here, and then I'm going to make sure that I assess him again after I'm done. I'll check his vital signs, I'll check his pulse, and I'll check his SpO2, and just kind of keep an eye on him. Get him positioned so he's comfortable, make sure there's nothing else that I can do for him. And then for this patient, where we're going to be suctioning multiple times, I'm going to go ahead and leave the nasal airway in as to not cause any extra trauma to the nair.